Hello, everyone, and welcome to the Multiple Sclerosis Association of America's live webinar, How to Search for the Right MS Therapy for You. My name is Peter Demiri. I'm the Senior Director of Programs for MSAA and will be your host for tonight's program. I'm looking forward to having a great presentation and very honored to have one of the top MS experts in the country here tonight to present on MS and the MSAA Search program. At this time, I would like to introduce our guest, Dr. Corey Ford. Dr. Ford is Professor of Neurology at the University of New Mexico, Director of the university's Multiple Sclerosis Specialty Clinic, and a member of MSAA's Healthcare Advisory Team. We thank Dr. Ford for being here and welcome him to the program. I would also like to thank the funders of MSAA Search Initiative. Tonight's webinar, as well as other search projects, have been made possible through unrestricted educational grants from Bayer Healthcare Pharmaceuticals, Biogen IDEC, and Teva Neuroscience. In addition to webinars, the MS Association of America provides a wide array of programs and services designed to meet the needs of the MS community today. Listed here are just some of the many services we provide, all free of charge. Just touching on some highlights include our new mobile phone app for MS, known as My MS Manager, our comprehensive website that includes publications, videos, and archived webcasts, 2 MRI programs, our very popular equipment and cooling programs, public awareness and education programs, and our expanding outreach on social media. Again, these are just some of the programs MSAA offers, so I invite everyone to go to our website or give us a call and participate in our programs and services. Okay, I believe we're ready to begin, so I would like at this time to introduce Dr. Corey Ford as he discusses how to search for the right MS therapy for you. Dr. Ford?
Thank you, Peter, and welcome everyone who's able to join us tonight. I'm really glad that you did. I can see a list of names, although I can't tell where you're from. I assume they're from all over the country. And it's going to be an interesting evening. I'm going to talk to you about a program that I think you'll find very useful to help you in your interactions with your physician as you consider what the best way to treat your MS might be. So in front of you are the objectives that we have for tonight. So very briefly, we'll explore the changing landscape of MS and go over what our current and future treatment options are. But we'll emphasize the importance of adhering to whatever treatment you choose to start. And I'm going to spend a considerable amount of time talking about the doctor-patient relationship and how you and we can work to make that better. And then I'm going to tell you about the SEARCH program, which I think is a very innovative and useful tool that will help you in your interactions with your physician as you go through these treatment decisions with him or her. So we're lucky that the landscape of treating MS is changing. Back in 1993 and before that, we had no FDA-approved treatments for multiple sclerosis. We had limited approaches to treating symptoms. We had some things that helped, but not very much. And I don't think that on a regular basis, that clinics and hospitals spent much time utilizing rehabilitation services for patients who had MS and disabilities. Because of that, you might have gone to the doctor back then and heard comments like, go home and rest and try not to do too much, or don't get exposed to the heat, or if you're a woman, you might not want to consider having children. So all these things, fortunately, have changed considerably, and I think that with the advances that we've made, life is much better for people with MS. So this rather barren and limited landscape that we had prior to 1993 has now changed. We have, as of today, 8 drugs that the FDA has approved for treating MS, and more are on the near-term horizon. We have a more comprehensive approach to treating MS and managing the symptoms, and the focus is not only on treating the disease and its symptoms, but rehabilitation and wellness. And we have expanded treatment options for managing different symptoms and strategies for using those. Here's our slide that shows you how we've progressed over the last 18 years. So around 1993, beta-seron, interferon beta-1A, or 1B, was approved, and this was the first drug ever approved by the FDA for treating relapsing remitting MS. That was followed shortly in 1995 by Avonex and Copaxone, and then Novantrone, which, or sometimes known as mitoxantrone. That's a chemotherapy, and it's significant because even today, it is the only drug that the FDA has ever approved for treating secondary progressive MS. But it does have significant side effects and issues, and I think it's fair to say that it's used less frequently than it used to be. That was followed by Rebif, which is another interferon, Tysabri in about 2005, which is a new agent that was given by vein once a month, but had some safety issues that you probably are aware of. And then Extavia, which is basically identical to beta-seron. Those two drugs come out of the same pot, and it's just that two pharmaceutical manufacturers share the patent rights to that pot, and so they can both market the same drug. And then, of course, Gilenya, which is a bit more exciting because it was the first ever oral drug, a pill. Ever since 1993, when beta-seron came on the scene, people have been asking, so when are you going to come up with a pill? Well, now there is one, and that is available on a daily basis to treat relapsing remitting MS. And then at the bottom right there to the right, you do see a list of medications that are under development and will shortly finish their trials and be evaluated to see if some of them may or may not become approved treatments for MS. They include laquinimod, a drug called BG12 or fumarate, and teriflunomide. All three of those are oral drugs. And daclizumab and alemtuzumab are monoclonal antibodies like Tysabri, although they're very different in their targets and how they work, that also show promise in treating different forms of MS. So the future looks bright. The present is better than it was, and this is an exciting time to be having to deal with MS because we have more things that we can give you and help treat the disease. So somebody said, and this is a good quote, these treatments work, let them work for you. And so using this theme, the Multiple Sclerosis Association of America, who are obviously sponsoring this program tonight, developed a national public awareness campaign to support treatment adherence. It was launched in 2007 and has been very successful. It has announcements in the print, on the radio, and on television. It's a simple, effective message that applies to most people with MS. These treatments work. Let them work for you, as studies continue to demonstrate the benefits of early treatment that is continued. So, to reiterate, these treatments work. That doesn't mean they're a cure. We wish they were. Sometimes we get close to that, and sometimes it's only partially so, but people in general do better on treatments than off. And research has proven that most MS patients who have relapsing forms of MS, who start a disease-modifying treatment and stay on it, tend to accumulate less disability over time, or they have problems that develop at a slower rate than patients who are either not on a drug or don't comply with the treatment. So we now have treatments that can reduce the attack rate, those relapses, by nearly 2/3. They can stop the changes on MRI scan, new lesions, by up to 90%. When they break through and the disease has a new event, the severity of that may be reduced because patients are on treatment. And they also slow the progression of disability, and they seem to delay the transition from that relapsing, remitting phase of MS into what we call that secondary progressive phase of MS, which to this day remains more difficult to treat. So, this is a very obvious thing. No drug is going to help you if you don't take it, or if you use it incorrectly, or if you stop it and you don't talk to your doctor about why and consider maybe changing to something else that might work better. So in recognition of this, there are a lot of programs out there already to support you and help you adhere to treatments. Some of these are from pharmaceutical support systems, some from organizations like S.E.A.R.C.H and others, and hopefully from your own MS specialty clinic where you receive your care. It's important that you learn about drugs, that somebody teaches you about them, that helps you manage side effects if they occur, and provides you with techniques for how to best give them to yourself to minimize discomfort and problems. And sometimes you need some support, especially when you're starting. You know, starting some of these drugs is a little intimidating, especially if you have to give yourself a shot, or maybe you have to go in and get a monthly infusion. You know, these things become routine, and people tolerate them very well. They are not in and of themselves very high barriers to treatment, but they are something that you have to overcome, and so supporting you during that initiation phase is very important. And then, of course, if there happen to be side effects or issues, we want to help you with those, and so it's important to manage subsequent problems. And the other thing that these organizations do is we're advocates for you in gaining access to these treatments. Insurance plans and even our own government is trying to reduce medical care costs, and in some ways, unfortunately, that kind of means putting up barriers to certain kinds of treatments, and we're all about trying to help smooth and lower those barriers and get patients access to the most appropriate drug for treating their MS. So what we're all about is enhancing the doctor-patient relationship. As Henry Ford said, coming together is a beginning, staying together is progress, and working together is success. So what we want is for the doctors to work together with the patients and all the support groups like S.E.A.R.C.H and all other resources available to make a team that really makes the best for the care of you and all of the symptoms and issues that you might have. And it works both ways. So here's some humor for you. There's always room for improvement. On the left is, I'm sure, a situation that all of you have encountered in your visits to the doctor. You show up at the desk and you talk to the receptionist, and she tells you your appointment with the doctor is at 11:15, but his appointment with you is at 12:15. And from the doctor's perspective, there's the patient sitting on the table listening to the doctor, and he says, "Give it to me straight, Doc. How long do I have to ignore your advice?" So, these are, funny and true at some level, and the kind of the issues that we need to resolve to be the most effective in our partnership as a doctor-physician trying to take care of a chronic long-term illness like MS. So MS is complicated, and as Woody Allen said, confidence is what you have before you understand the problem. MS is complicated, but fortunately, we're understanding it better. We know more about it, and even more important for you, with MS, we're having better success with new treatments that alter the disease, slow it down, and prevent problems. So given the complexity of this disease, it's really important that the doctor and the patient work together so that we understand your problems and that you understand our advice on how best to manage those problems and have successful solutions to the issues that you face. That's going to be easiest if we are able to jointly establish an open, honest relationship and communication that involves trust, that enhances the accuracy of the diagnosis and treatment options, that improves your willingness to go on these medications or any treatment and stay on it, that increases your satisfaction. We want to reduce your complaints, and all of that's aimed at giving you the best possible health and the overall best quality of life. So doctors can do a number of things to strengthen this relationship, and I hope that each of you has a doctor who embodies these key points. But the doctor will hopefully show empathy and understand what you're going through and how that has impacted your life, and be willing to listen to your issues, whatever they may be. Hopefully he can slow down enough, or she, to recognize that each visit may be unique, and that the problem you come in with on a given day may not just be related to MS, may be related to something social in your life, or a mood issue, or some other stressor that's going on that needs to be taken care of. They should be flexible and tailor their response to help you meet the needs that you come in with, whatever the presenting issue might be. And sometimes you go through the workup and the diagnosis process for MS. You get your scans and spinal taps if you need one, other labs and such, and that all takes some time. But when it comes down to the point where you're ready to consider a treatment, sometimes it's best to not do that on the same day, because that's a whole discussion in and of itself, and people have to process the whole idea that they've just been told they have MS and that they should go on a treatment. So many times it's really better to reschedule or schedule another office visit where the focus can be on discussing treatment decisions that need to be made. Now, as a patient, it would help for you to be proactive and, to some degree, take charge of your own health care. So as you go out and look for information, and everybody does that now, you go on the Internet. Of course, that's a great place to start. But try to point yourself toward credible Internet sites. The Internet is an amazing place, and it's full of information that's both accurate and some that is really odd and off the wall. So you have to be careful that you get your information from reliable sources. You could keep a journal. And the MSAA actually has a nice new iPhone app called My MS Manager, and there's a screenshot there to the right of this slide, but where on your own smartphone you could keep track of your health records and access MS News from the web by touching that button, or generate a personal report to help you remember things. So there are all these tools now because of our information technology age here that can help you with your problems and keeping track of the communications you want to have with your providers. So you need to maintain your other health care needs and your other appointments. So it's really important that you not skip your primary care physician and go for your routine checkups to get your pap smears, your breast exam, your prostate exams, and colonoscopies and so forth. Don't neglect the rest of your health as you try to deal with the MS issues that you may be facing. You need to understand that there are increasing constraints on the healthcare system. We are under pressure to see more patients. There are more of them all the time. If the current healthcare plan comes to fruition, there will be 30 million new Americans who have healthcare insurance. Not that they weren't necessarily being seen from time to time, but now they would have access on a regular basis in a situation where the number of patients goes up by 30 million, but the number of doctors doesn't. And then there are the managed care restrictions and the payer restrictions who are looking at how to minimize and reduce costs of health care. There are many issues associated with that which we don't have time to go into, but they are all constraints that we have to deal with as you and I get together and talk about your problems with MS. So time may be limited, and so it's important that you come to the doctor's visit prepared and maybe have a list of the things that are most important to you that day. You could prioritize a list of questions. Bring your medication list so that we can tell what you're on and make that easy to know, so that we can take maximum advantage of the time that we do have while you're there for your appointment. So how do we make sense of all this? So here we are. We used to have one treatment and then two different categories, actually, even though there were 4 different drugs. 3 of them were interferons, and 1 of them was Copaxone or glatiramer acetate. But now we have 8, and that makes the decision-making a bit more complex and tricky. We continue to believe that most people with MS should begin treatment early and stay on the drug until either it doesn't seem to work, or our side effects are intolerable, or something better comes along. Making that decision to go on a treatment is somewhat personalized, and that's where you need to consult with the doctor, talk about how these kinds of medications fit into your wellness plan and what the doctor thinks might be best for you, and come to a mutual decision. But again, since time is limited and there's so many questions to remember and organize, what is the best way to have this conversation, and how could you maybe structure that? How do you make sense of it all? This is the tool that this S.E.A.R.C.H program is attempting to provide for you. So let me introduce the S.E.A.R.C program. S.E.A.R.C is a word that's an acronym. So each letter in the word S.E.A.R.C stands for something that's important for you to talk to your doctor about, to remember and organize as you come to visit with your healthcare team. S stands for safety, E for effectiveness, A for affordability, R for risks, C for convenience, and H for health outcomes. So think of the S.E.A.R.C.H program like a GPS device here. It's a guide to help you get where you want to go. It may help you navigate this changing landscape of MS, help you recalculate treatment decisions and make a change in course when necessary. Sometimes you can't stay on the same drug forever, and you do need to make a change. This S.E.A.R.C.H plan can help you make that decision. And then you want to reach the destination that you want by finding the best path for your own healthcare needs and beliefs. So here are the directions for using the S.E.A.R.C.H tool. Each of the subject areas or the areas that are represented by the letters of the acronym is of equal importance, and no one topic is necessarily more important than the other, and it's all about what's best for you. It's good to review all areas of the S.E.A.R.C.H protocol first to fully understand them, and then go back to the topics that are of most interest and concern to you. Recognize that these S.E.A.R.C.H questions that we're going to show you serve as a starting point, so it will help you organize your medical situation, your needs, the issues that you have, and how to prioritize them so that when you bring them to the doctor's office, you've got it all organized and it maximizes the benefit of that visit. So focus on the key areas, do some research on your own, develop questions for your office visit, and sometimes I think it's even best to call in advance, to schedule a treatment discussion with your doctor. In other words, sometimes if you have an appointment and you show up and the doctor doesn't know you have any specific questions, he comes in, asks how you're doing quickly, brings out his stethoscope or his reflex hammer, bangs on your knees, looks at your eyes, shines a light in your eyes, has you walk back and forth and says, well, it looks like you're doing fine. We'll see you again in 6 months. And maybe that's not what you need. So sometimes it's important to call ahead and tell the receptionist that you want her or him to notify the doctor that the visit is for you to come in and talk about issues related to your choice of a treatment, and for him to be thinking along those lines rather than something a little more like the exam process that I just described. So let's go through the elements of the S.E.A.R.C.H program one by one. The first letter is S. That stands for safety. You can't underestimate safety. Drugs can be effective, but if they're unsafe or dangerous, that's a whole different issue. And MS is a disease that rarely shortens people's lives. So we want the drug to be safe as well as effective. So when you go to the doctor, with respect to the therapies you might be considering, you might ask things like, what are the long-term safety profiles of these FDA-approved drugs? What are the laboratory tests or MRIs that I might need before I take it or while I'm receiving it? Do I need to get routine lab tests to monitor toxicities, for example, liver issues? How will these drugs interact with my current treatments? If you're on other drugs for diabetes or high blood pressure, for example, will these drugs interact in any way? And will they have any problems with other medications that might be important to you, complementary and alternative medicines that you might have in your wellness plan, like vitamins or other supplements? And what are the concerns about pregnancy? If you're a woman and of that age and want to have a baby, are there issues there? What about breastfeeding if you have a baby and you're on one of these drugs? So these are the kind of problems or questions you might ask on the safety question. The next letter is E. That stands for effectiveness. Obviously, we don't want to give you a drug that isn't effective. All of the drugs that we're prescribing are FDA approved because they were effective. But those are in clinical trials, and clinical trials are tests that look at these drugs relative to some comparison, sometimes a placebo, and maybe we're looking at many hundreds of patients or even a couple thousand, and show that overall, as a group, people who receive the drugs do better than people who don't. But that doesn't always necessarily apply to an individual, and so sometimes treatment decisions have to be made specifically for you. So you may be one of the ones in the group that's a super responder, and for you, that drug treatment is the next best thing to a cure. Or you may get benefit that slows down, reduces disease activity, minimizes disability or MRI activity, but isn't 100% effective. And so there are some breakthrough issues. And then it becomes a question of, well, at what level are those of significance, and should we consider changing to something that might work better? And occasionally, there are people who just don't respond to a particular drug. That needs to be identified, and then you need to move on perhaps to one of the options. And that's why it's important to have multiple options, because you have new or different drugs that you can move to. So questions you can ask your doctor. How effective are these disease-modifying drugs in reducing MS attacks or relapses, slowing the progression of disability, and slowing down the changes that might occur on MRI? What are realistic expectations that I should have about the effectiveness? You need to understand that most of the time these drugs are not a cure. And so you may actually have ongoing MS activity at some level, but it should be better than it would be if you weren't on the drug. And sometimes there are side effects. And those side effects can actually make you feel worse than when you were not on the drug. Even though the drug is working to minimize the effects and the problems with MS, you may be having side effects. And so at some level, you may feel like nothing's happening that's good and everything that's happening is bad. You need to have that conversation. How can you tell if the drug is working? MS is generally slow. If you're looking at relapses and you're having one a year, you'll have to wait a year or more to tell if you've actually made a difference. And if things aren't going well and you're not tolerating it, when should I consider a different one? The next letter is A, affordability, a big issue. And it's something you need to consider. Your insurances will cover many of these drugs, but sometimes they're putting them in an order that works for them. So they say you have to start drug X or drug Y first before you get drug A or B. And then there's the copay issue that can significantly have an impact on your budget. You need to ask your insurance plans, whatever that may be, what your share of the cost might be. And, you know, to be honest with you, I think it's fair to say that they're all too expensive. But that's the situation we're in, and we have to work with you to get you on a drug that will work. Now, the other part of this is your doctor may be relatively ignorant about what the costs of this drug are, especially to you. So they may have an idea of what it may cost overall, but as far as your specific insurance copays and such, that can be something that they're not so sure of. So you may need to ask a social worker or the insurance company or an MS organization to find out what those costs will be, and whether you're going to be driving a Lamborghini or maybe a Volkswagen Bug, both of which may work for your disease. So here are the questions you might ask. What are the costs, and what is the insurance coverage for this drug? Does the insurance coverage have a gap or a cap or a limitation that may affect you down the road? If you're having trouble with it, will there be assistance programs either through the pharma company, the government, or other charities? The fourth letter is risk. So you need to consider, what are the risks of side effects with the drug that you're thinking about going on? How frequently and how severely might these side effects occur? Will they resolve? Sometimes you may have side effects that are more bothersome early on and that resolve and are not a problem later. If they do develop, can they be managed? Is it just an issue of taking Tylenol or ibuprofen and that will be good? Or are they more significant than that? And how do you balance the risks and the benefits? And this is a question that's, again, a relatively individual issue. So you need to have these conversations, and these are some sample questions you might write down in advance of your doctor visit. C stands for convenience, and this is an issue that varies depending on the person. So you want to know, how is this disease-modifying drug given? Is it a pill? I just pop it out of the bottle and swallow it like I do an aspirin? Or is it a subcutaneous shot under the skin? Do I have to give it in a shot into the muscle? Do I have to go into an infusion center and have an infusion? And if so, how often? Is that once a week, once a month, once a year? All these things are actual intervals at which certain treatments may be given. And then, separate from giving myself the drug or getting it given to me, do I have to have regular tests or visits to other healthcare providers to monitor the effects? Do I have to see a dermatologist or an ophthalmologist or any other specialist just to help monitor the issues associated with the particular drug I'm on. And lastly, health outcomes. So what you want to know is, how will your general health and quality of life be affected? If the drug has no side effects, well, then perhaps there's no effect on your quality of life. Although that said, some people, I think, give themselves an MS drug either by injection or even as a pill, and to some extent, every time you open the bottle or pull out the syringe, it's a reminder that you have MS, and that can be something that can affect your mood and your quality of life. You might ask, how will my MS look in 5 or 10 years? Obviously a difficult question to answer, and nobody has a crystal ball, but it's important to look ahead and ask what might be the best case scenario, or what do I have to think about, or what might be the outcome down the road that I need to know about, or at least think about as I make other decisions about how my life will go. Some disease-modifying treatments are immune suppressive, meaning they reduce the effectiveness of your immune system, and that may mean you're more susceptible to infections or other complications, and you need to know that. Others don't seem to affect the immune system in that way, and so there isn't a big issue with other infections different from somebody who's not on an MS drug. And can these drugs assist your mobility with your thinking, memory, cognition, and other health factors? So what you want to do is maximize the benefits of this search paradigm. There are a lot of informational tools that the MSA has prepared that can help you, and you can download those at their website. And I think you've probably been given that, but it's written up there for you again if you don't seem to have it, www.msassociation.org. And among those materials are a workbook that gives you a place to write down things, to collect your ideas, your questions, problems, and issues that develop, and organize and store them. There's a disease-modifying therapy chart that shows you the available therapies and compares them in terms of how they're given, how often they're given, side effects that they may or may not have that can help you. There's an MS resource guide that lists all the MS organizations and pharmaceutical company programs that might be useful for you to contact to get assistance and make using these drugs easier for you. And then a reference card that's laminated that you can put in your wallet or purse so that you're just never at a loss when you're getting ready to go to the doctor and you say, oh my gosh, what am I going to say? What am I going to want to deal with today? You can pull out the card and look at it again, jot down some specific ideas or needs, questions that you have that you want answered, and then you'll have a better visit. So to wrap it up, you can look at MS as an ever-changing landscape, and that can be confusing. But it's a good kind of confusing, because the more complex it becomes, what that generally means is that we have more options. And somewhere in there, we hope that there's an option that's right for you. And the future looks bright. So we're getting better, we're getting more drugs and more effective drugs. Some of them are pills. The promise looks very good for the future. Remember, adhere to that statement. These treatments work. Let them work for you, and get on a treatment if it's appropriate and stay on it. You may find other things that you want to use in your wellness plan, like alternative and complementary kinds of medications, but try to resist using those to the exclusion of drugs that have been tested and proven to work for your disease. Maybe you could talk to your doctor and use both of them together. That may be a better option than abandoning the drugs that are proven to be effective for those that are really not shown to be effective for the disease. Work to have an open, honest, and positive relationship with your doctor. Be proactive, get involved, learn what you can about the disease, write down your questions, and be part of it. And then I think this search tool is a very great idea. It will help you coordinate and organize your ideas and needs so that when you make the visit to the doctor, you can maximize that and get the best benefit in achieving the optimum health and wellness program. So, other words to inspire your continued success. Benjamin Franklin said, "Energy and persistence conquer all things." Dolly Parton said, We cannot direct the wind, but we can adjust the sails. Carol Burnett said, only I can change my life. No one can do it for me. And Albert Einstein said, it's not that I'm so smart, it's just that I stay with problems longer. So in all of those comments, I think there's some wisdom that fits into this S.E.A.R.C.H program and your involvement in managing your disease and your MS. Use these to your advantage, use this tool, and I think that the outcome will be better for you. I'd like to thank you for your attention. We're going to be able to answer some questions, and in order to do that efficiently, I'm going to turn the program back over to Peter Domini, and he will go through as many questions as we have time for. And thank you very much for joining us this evening. It's always a pleasure to have an opportunity to interact with people from all over the country at a distance like this, and I hope that it was helpful for you. Have a good evening.
Thank you, Dr. Ford. That was great. That was a lot of information and great suggestions and ideas. So I think hopefully it'll benefit a lot of people. Okay, it's now time for some Q&A, and that is certainly the benefit of doing a live webinar like this, that you get to do the polling questions early, but then we get to have some Q&A with the people that were listening in. And there were actually quite a number of people that were busy emailing questions in, so I love it. I'll start off with a question that came in earlier that said, I like the way of using S.E.A.R.C.H to think about this issue. What if I prioritize my questions but still have too many to fit into my doctor's appointment? How can I get them all answered?
Well, that's a good question. I guess there isn't anything in life that can't be overdone in a way, and you're right. If you go through all of the elements of the S.E.A.R.C.H acronym, that is a lot of information, and I think one of the key issues here is to recognize that you may not be able to ask every question at a visit that's maybe 30 minutes if it's a follow-up, or if it's a new patient visit, it might last an hour, but then the doctor needs to hear about how you developed MS and all those other questions, so there won't be quite that necessarily that amount of time that you'd like to have. So I think you included the answer in the question, which is whatever you've written down that you'd like to have answers, prioritize them. So say, if I only had a chance to get answers to some of these, which ones would I like to have answered first? And put them at the top, and just go down your list one by one with the time that you have. And if the doctor says, well, I'm sorry, I'm going to have to wrap this up, and I know you have more questions, you can say, well, perhaps we should reschedule a visit down the road, and I can ask those later, or could your nurse answer these, or is there some other place like the MS Society or the MSAA that I could go and get some answers? Yeah, so again, be creative with that part of it as well as the others.
Great answer, great answer. Before I ask the next question, just want to remind people, because I do see it coming up frequently on the chat box, is that this program will be available for viewing as an archived webcast on our website, probably within a week to 10 days. And then with that, we also will have the slides of the program available to view as a downloadable file, as a PDF file. And as Dr. Ford mentioned, we do have quite a number of assistive tools for S.E.A.R.C.H. So we have the workbook and a card and a chart. So you can go on our website as well and check out some of those. Next question is intriguing, and I'm sure it's getting a lot of discussion at different programs, is will the upcoming healthcare reform bill limit the availability of these drugs and my doctor's ability to select a particular treatment for me?
Well, good question. I guess we're all anxiously awaiting to see what turns out of this. So, well, let's just review where we are very quickly. Currently all the drugs are technically available because they're FDA-approved treatments for certain types of MS. So at the bottom line, if your doctor really believes that it's the right drug for you, he should be able to write a prescription, and most of the time that will be acknowledged or are filled by the insurance plan, because if they cover the drugs, that's just one of the things they'll need to do. Now, that said, the MS experts have really not been able yet to create an algorithm, sort of a flow chart, if you will, that says patients with MS should start on drug X, Y, or Z, and if they don't tolerate those or have breakthrough disease, they should be considered for drugs A, B, and C, and if they fail or don't tolerate those, then they could go on to drug D, E, and F. If we had that, then that could be a consensus kind of best care algorithm, and the drug or the insurance payers would follow it, but they don't because there isn't one. So your insurance plan can actually say, well, we understand there's a new pill out, but it's so expensive, we want you to try one of the injection drugs first. Now, that's okay because they're effective and they've been around a long time. We know they're safe. We know their side effects. And so it's not necessarily unreasonable, but, it's an option. It's what happens. Now, whether in controlling costs, the government is going to ban or put up obstructions or barriers to certain treatments, I don't know. They could do all kinds of things. If healthcare costs continue to spiral out of control, I think, we're going to have to face a lot of what you might call rationing or at least directed kinds of treatment. And they will look at the costs, and they will ask, if we spend that amount of money and we get a certain response in the disease, is that worth it to society, or is it worth it to the individual? Two very different questions. We haven't had to deal with so much in the U.S., but other countries do. If you go to some countries in Europe, their health plans will say this drug and that drug, although they're approved in the U.S., are not available to you. So I think it's an open question, and drugs are very, very expensive, and the drugs for MS have become even more so than they were. Drugs that were developed 20 years ago have undergone price increases. The new drugs are extremely expensive, and these are not drugs that people take for 2 or 3 years and then they're done. These can be lifetime drugs, so the numbers start to add up in a very significant way, and the payers have noticed. So this is where we're at, and I think at the end of the day, I'm hopeful that there'll be some kind of a reconciliation between those who pay and those who provide, so that those who need can have access to the drugs at a reasonable price that provides, reimbursement to the people who developed it and the companies, and don't break the bank for the government and the other insurance payers. It's a long answer. I apologize for that, but it's not an easy answer.
No, that certainly is a very complicated situation that changes daily for sure. Next question. I mean, this is probably at the heart of the matter for a lot of people with MS, and I know I hear this a lot of times at different programs, and it is, how do you really know if a treatment is working for your MS?
Well, so how do you know a treatment's working for MS? Well, that's a question with several answers. So, one, if you don't tolerate it, it's not going to work for you because you're going to feel worse on the drug than you did before you went on it. Number two, you want to have it affect something about your MS that maybe was a problem before you started it. So if you were having attacks and relapses, you'd like to have fewer or none of those. If you're having progression of disability in vision or walking or other issues, you'd like that to slow down. Or I'm sorry, I lost my train of thought there. MRI would be another. So even if you're doing well and you're not having a lot of new symptoms, but you wonder, is the drug really working because MS can occur silently, then you do an MRI scan, and we expect a drug that's effective to slow down the MRI as well as slow down your symptoms. So I think you have to take it all into consideration. I think it can take, it's certainly not something you can tell in 2 or 3 months. I think you need at least a minimum of 6 to 9 months, and probably better a year of experience with the drug to know whether it's having a benefit.
Okay, here's more of a specific question. After giving birth, typically how long should you wait before resuming a disease-modifying therapy?
Very good question. So currently, almost all of the MS drugs would come with the advice that you stop it if you're planning to or if you become pregnant. The one exception to that might be Copaxone or glatiramer acetate. Because it is a Class B drug in pregnancy, it can actually be continued during pregnancy if you and your doctor agree that that's best for you. So if you've continued it through pregnancy, then there wouldn't be much of an issue through the pregnancy and into the delivery and postpartum phases. If you're breastfeeding your baby, then the next question would be, is the drug any kind of a risk for a mother who's breastfeeding? And for some, it is. And so the obvious answer then would be, well, go ahead and breastfeed your baby until you're done and then restart the drug. If you're not breastfeeding the baby, you could restart essentially very quickly after the pregnancy is terminated or you've delivered and get back on the drug.
Okay, and somewhat on a related note, there were a couple questions that not to get into each specific therapy, but just generally, if people are, as we mentioned in the S.E.A.R.C.H acronym, you might want to recalculate and change course and maybe switch a therapy. So if doctor recommends that a person wants or needs to switch a particular therapy, is there a wait period that they need to have that drug dissipate and before they continue another therapy?
Well, that's another good question. And so as we get more treatments, they're very different drugs. They all work by different mechanisms and have different effects on the immune system. And some of those are short-acting, some are longer-acting, some are very long-acting. Some may have interactions and others may not. And we don't always know that because we don't get very many opportunities to test them together to know what the combined effects may be. So this is an area where you really need to have a careful conversation with your doctor and maybe even an MS expert, if that's what's needed, to ask those questions of, if I'm on drug X and I want to change to drug Y, should I stop X and immediately start Y? Should I stop X and wait 1 month, 2 months, 3 months, and then start the next drug? Those are all very, very legitimate and tricky questions that are best dealt with on an individual basis once you know the names of the drugs and the person and the patient themselves.
Okay, very good. We have 2 more questions that we're going to have time for. So one is, although this program is mainly for people who are relapsing remitting MS and are candidates for the disease-modifying therapies, there were a number of questions concerning the progressive side of MS, and people wanted to know, I guess, what's the status of any research in that area or what might possibly be some future treatments in that area?
Sure. Well, secondary progressive MS, let's think of that as a phase of MS that you might slip into after you've had MS for 10, 15 years or more. And instead of disability or problems coming in relapses that come on suddenly, things change relatively gradually and slowly. And the bottom line of that is it's been a pattern of the disease that's been more resistant and difficult to find effective treatments that slow it down. So a number of things have been tried. In fact, most of the drugs that we have for relapsing MS have gone into some studies for progressive forms of MS. Interferons are one, and there was a trial of interferon that showed some modest slowing of secondary progressive MS at the early stage. There have been studies of another drug, glatiramer acetate, that was tested in primary progressive MS, and overall that study was negative, but the men in the group did a bit better on the drug than off, and so there's some question that was not really definitively answered by the study that maybe it has a role there. I mentioned earlier that mitoxantrone, the chemotherapy drug, is the only FDA drug that's approved for secondary progressive MS, and it can be effective, but comes with some significant toxicities and long-term risks and side effects that generally at the least dampen enthusiasm for using it in a disease like MS that otherwise lasts a lifetime. So the short answer is we're still looking for that really effective, good, and safe treatment for secondary and primary progressive MS. Currently, there are clinical trials ongoing for a number of agents. I'm hopeful that one of these someday will hit and prove to be effective and become approved for the progressive forms of MS. If you have an opportunity and live close to a center that does studies, there may be one of these secondary progressive trials, and maybe today, if you have access to it, that's the best option to get access to a treatment that could be effective, that is not currently approved, that helps move the field forward and develops the next group of treatments for the future.
Okay, and our last question I think, speaks to the overall management of MS, which I think is very important. So in addition to being on one of the MS therapies, what role does diet, exercise, and trying to keep stress down play in helping to manage MS?
Okay, well, so diet. In my opinion, diet is very important in MS as it is for any other health condition that you need to eat healthy with all the recommendations that go with diet for all people, limiting your salt intake, limiting your red meat intake, limiting fats and cholesterol, eating vegetables and fruits, and maintaining your weight in a healthy range. Those are all the things that you should strive to do. MS does not appear to be a dietary disease, so there are no supplements or dietary changes that appear to alter the course of the disease and improve the disease itself. They can make you feel healthier, and if you're healthier, you do better, and I think that's by and large what you should strive for. Exercise, also important for some of the same reasons. Exercise makes your body healthy. Exercise helps you resist issues that might come with MS, like weakness and other problems and balance issues that are better if you remain active and strong. And you might even consider exercise to be something that should be prescribed. That MS patients should be really encouraged to go and engage in exercise and maybe go to physical therapy from time to time, or get some help learning how to do regular exercise to keep themselves fit. And the last one, there were three. It was diet, exercise, and what was the third?
Keeping stress down, if that's possible.
Right. Well, a little bit tongue-in-cheek, but I always tell my patients when they ask about stress, if they figure out how to eliminate it from their lives, would they please share it with me? So everybody feels worse with stress, and that's, I think, particularly true for people with MS. Your resilience for a variety of reasons may be less because you're fatigued and you're tired, or your mood may be affected. So there are lots of reasons why stress, cognitive problems, memory problems, all these things may inhibit or detract from your ability to handle the kinds of stresses that you used to. So, if you can eliminate a stress from your life in a healthy way, obviously that's the obvious, easy way to go. I think that it's not really definitive that stress makes MS worse by causing new relapses and new disability. That's actually been tested in a number of ways, and it's not like you get stressed out or you have a car accident and you suddenly have a new MS symptom. Sometimes it seems that way. So I think you just need to manage stress in a very proactive and common sense kind of way. Eliminate what you can. Go on vacations. Do the things that you enjoy doing, your hobbies and such, to minimize it. I don't think anybody can actually eliminate it, And that probably shouldn't be your goal. Your goal should be just to live life, to be engaged, to be part of it, and I think that that's the best way to go.
Well, thank you for that. We are going to prepare to conclude for the program tonight. Before we do, I do want to remind everybody to stay connected until the very end of the webinar, because immediately following is a post-survey evaluation that is very important, and we would really appreciate that you hang on until I just wrap this up. So this does conclude our webinar, How to Search for the Right MS Therapy for You. As I mentioned, it will soon be posted to our website along with the slides. I would like to very much thank Dr. Corey Ford for his excellent presentation tonight on MS and our search initiative, as well as our sponsors, Bayer Healthcare Pharmaceuticals, Biogen IDEC, and Teva Neuroscience. Once again, thank you so much for attending this webinar, and have a great night.